Welcome to Ready to Work. We are excited that your career journey has led you here. We've designed this Ready to Work program to prepare you to start work as a healthcare professional in as little as 2 to 4 weeks at absolutely no cost. Now that you've taken the first step in the application process, make sure you're officially enrolled. Complete the zero-cost enrollment and you'll be on your way. Our Ready to Work career training program will take you from the classroom straight into a job. We've teamed up with local employers to help build their healthcare team with new candidates just like you. With great pay and fantastic benefits, landing a job with our partner employers will be as easy as 1, 2, 3. Step 1. First, you'll complete the online job training to learn the foundations you need for success in healthcare. The online training has been set up to be completed anytime, anywhere, on your schedule. Step 2. Once you've completed your online courses, you'll be ready to start in-person labs. All you need to do is sign up for lab sessions held in your area. Our seasoned instructors will take you through a variety of exercises to ensure you gain the hands-on experience required to start your new job as a practicing medical assistant. In addition to attending live labs, you'll also have the opportunity for more practice through our virtual simulators. Step 3. You made it. Now the easy part. It's time to build your new resume to show ready-to-work employers you have the skills they're looking for in new hires. We'll walk you through every step to ensure you're ready to put your best foot forward and get started in your new career right away. Our learner support team is available 24/7 to help with any questions and assist with national certification and a certificate of completion from our university partners. With Ready to Work, you have everything you need to start your new career in healthcare. So what are you waiting for? Let's get ready to work. Hey guys, welcome to our Ready to Work webinar. My name is Katie Garcia and I'm with Ready to Work. So today, we're going to have an interactive session. I'm going to go through my PowerPoint slides and kind of give you some information on the program, and then we'll open it up to questions at the end. And I do have a team behind me, behind the scenes, that if there's a question that I can't answer, they can definitely help answer those questions as well. So let's jump in today. So at Ready to Work, our mission is simple. We want to provide you an effective solution around skills achievement and career services that connect learners to jobs. So it's not just about, getting your education, and it's not just about job searching, but it's about bringing those two things together. So, at the end of your program that you will have job opportunities guaranteed. So currently, we're working in the Boston area as well as the Detroit area. We might have some people on from Boston and Detroit, so welcome. In Boston, our current hiring partner is Mass General Brigham, and they're looking for candidates who are motivated, reliable, trained, and qualified. So a lot of our students or our learners will say, well, I'm motivated and I'm definitely reliable, but I don't have the training and qualification. And that's really where Ready to Work comes in. We go to my next slide. So Ready to Work is powered by Campus Ed. And in Boston, our education partner is UMass Global. So Ready to Work, it's a completely free pre-employment screening and qualification program. Again, our education partner is UMass Global. So they'll take you through everything you need to know to qualify for a healthcare position in just some as little as 3 weeks. Some of our candidates takes 4 weeks, up to 6 weeks, 8 weeks. It just really depends on your schedule. And that's really how the program is designed to fit into your schedule. So right now we're hiring for health systems medical assistants. And a lot of those jobs are paying up to $20 an hour. So it's a great career move. So as I mentioned, we're hiring for that health systems medical assistant in Boston. Mass General Brigham is our hiring partner. We're also hiring for the same position in Detroit. We have people that have actually already been hired on in Detroit, which is amazing news. So as I've mentioned, you will go through this program, you'll go through the education component, and at the end of your education component, that's when we'll connect you with our hiring partner. So I would encourage you, if you haven't signed up today or you're thinking about signing up, definitely sign up, get started, and see what you think. There's really no risk to starting the program. So, with the medical assistant position, if you're hired on with one of our healthcare providers, with one of our healthcare partners, there are amazing benefits in addition to that great salary of up to $20 an hour. Many of our employers have benefit packages that include medical, dental, and vision. A lot of them have tuition reimbursement. So, after you become complete this program, if you want to continue on, they have even more options for continued education. They have retirement plans, they have scrubs to start with, paid time off, and some even offer shift differential. Of course, every health system's different, but we did want to give you some examples of things that you can look forward to. But as I said, everybody's a little bit different, but this is just a sample of some benefits you can look forward to. So let's go through the candidate timeline. So with this program, with Ready to Work, we have put everything into different checkpoints so you know exactly where you are on the candidate timeline. So the checkpoint 1 is you are going to enroll. So enrolling is super easy. My team will drop the link in the chat and down below. So all you have to do is sign up, put your information in, and you can actually get started today with your online content. So our online content is the Healthcare Foundation. So it's going to set you up with everything that you need to know to move into our in-person labs. So we have signing up, starting your online content, and then moving into in-person labs. And so the in-person labs are some of the most fun things to look forward to in the program because you're going to get to learn in real life from our seasoned instructors. And a lot of our instructors have been in the medical field for more than 20 years. So you are really learning from the best of the best. And not only that, but you get to meet other students in the program, meet other learners in the program, get to know them, get to talk about, things that they're working on, things that they're interested in, really form those friendships as well. So after you complete your hands-on labs, and there'll be 2 lab sessions that you need to complete. In those labs, we schedule on the weekend in different parts of the city to really give everybody an opportunity to take labs because we all know you're busy, you might be working full-time job, you might be having family obligations, different things like that. So we really try to make those in-person labs fit into your schedule. And after that, you'll be ready to take the Ready to Work exam, and that is just a skills check to make sure you are ready to move on to the hiring process. From there, we'll connect you with one of our employee partners to go through that hiring process, to do the interview skills, to brush up on your resume and things like that, to then hopefully place you in a job at the end of the program with one of our employee partners. So again, I know that might have sounded like a lot, but we do have a learner support team who is there to walk you through every step of the way. So don't worry, we know you got this. So in addition to our timeline of different activities, we have had some of our learners qualify for what we call the Fast Track program. So the Fast Track program is designed to take you through the program even quicker. And it's designed for people that may already have healthcare experience. Maybe you already have a healthcare certification, like an EKG certification, or you've started a medical assistant program or a different medical training in the past. So you have some foundation work. And then what we can do is basically work with you to be able to run some test out programs and some lab credentialing to then put you in contact with our job placement team faster. So if you think that you might qualify for our Fast Track program, definitely contact Learner Support. And again, I'll have my team drop the Learner Support email in the chat as well. So if you think you qualify or think you might qualify or want to talk to our Learner Support team a little bit more about our Fast Track program, definitely reach out to them. They are standing by and ready to answer your questions about Fast Track. So the other thing that we wanted to talk about is what we call our final 3 steps of the program. And the final 3 steps go into place once you've completed your online programming and you've completed your labs. So after you've done the program work, there's the final 3 steps. So You do, after the labs, you'll need to take your ready to work completion exam, and then you'll need to pass it. So you shouldn't have any trouble passing this exam if you've attended labs and done the online content. Once you pass this ready to work completion exam, you'll be ready to start interviewing for jobs. And this just really means you have the skills necessary to start working with patients, to start working in that healthcare setting. So then once you start interviewing and you're hired on with one of our employee partners, like as I mentioned in Boston currently, we're working with Mass General Brigham. You must get hired on with an employee partner that we're working with. It can't just be anyone in those first 90 days. So once you're hired on, we start our 90-day clock. And so you must be employed with our employer partner like Mass General Brigham for at least 90 days to receive your ready to work completion certificate. And then after those 90 days that you're hired on with our employer partner, you can then take the national certification exam. So those 90 days are really put in place to make sure that the candidates that were hired are showing professionalism. They're demonstrating the skills needed to be part of that valuable healthcare team. And, really this position, it's not meant to be a temporary position. This is meant to be a career. So those 90 days are really helping to ensure that this new job for you is actually a new career. And we have had questions before on, does this 90-day mean that I'm like not a real employee or part-time employee, or am I getting paid? You are getting paid. You are a real employee. Nothing changes on that end. It's just on the ready to work end. Then we put that 90-day clock in place to make sure that you can take your national certification exam and that you've shown the skills necessary to really excel in your career. And so a little bit more on the 90-day requirement. Again, we also want to make sure we're providing top-notch candidates to our employer partners. That's going to make sure that everyone in the program gets the same hiring opportunities. And we want to be able to offer you the best of the best as well. So this just helps put those assurances in place, not only for our candidates, but also for our employer partners. And again, I just want to reiterate, then during those 90 days, you were getting paid up to that $20 an hour. You are a real employee with the hospitals. The 90 days is just that last part of completion to be able to sit for that national certification exam and get your certificate of completion. And I can answer more questions on that at the end as well. So currently we're recruiting for that health systems medical assistant, but definitely keep checking back. We'll have some more lives coming soon as we launch more programs such as pharmacy technician and dental technician. If you've completed health systems medical assistant, you can always come back and take more of our programs as well. And another question we get a lot is, what do you mean by free? So when we say that this program is free, it's tuition-free, risk-free, we really mean it. So everything's covered. Your enrollment fees, your virtual lab practices, resume development, lab supplies and materials, your online content, it's all free. Not to mention, once you're ready to sit for that national certification exam, that's also covered. So what we really ask from you is that for your commitment, your motivation, and your time, we're really looking for candidates who, again, are ready to start their new career. We're not thinking of this as something temporary. We're thinking of this as something that you can launch your healthcare career into. And we really are excited about all those people who want to be part of the Ready to Work program. So we have a little bit more information if you're, for example, wanting to learn more about labs. On our YouTube channel and on Facebook, we actually did a lab with our with our lead lab instructor, Deanna, in Detroit. And she talks a lot about what you can expect in labs, what you'll practice, what you can expect for that day. So definitely check that out if you're feeling a little bit apprehensive about labs as well. So we would definitely encourage you to get started today. Sign up. We're recruiting for the health systems medical assistant right now. Again, it's Ready to Work is powered by Campus Ed. We're hiring in Boston and Detroit right now, and UMass Global is our education partner in Boston. So we're really excited that you guys are here. And now I think it will be a great time to open it up to any questions that you guys might have today. And while I'm waiting for questions, I'm going to take a quick drink of water. All right. We have a question popping in. Okay, so somebody's just popped a question in that says they have one more test left, and what do they do after that? So they're taking I think we are the patient care technician program, and they have one more test left. So they're asking what's the next step after that. And I believe you're probably referring to the online content. And you can contact learner support, and they can look up your progress and status to figure out where you're at, and they can help determine what part of the program is next for you. And you can also let them know that you're completed, and they will help get the ball rolling on the next steps for you. But congratulations on being almost done. That's awesome. Yep. And then they'll also help get your resume together and your application started. So they will be your support for completion. So we had a question just come through that says, what does health systems refer to? Health systems medical assistant is the job title, and health systems just mean multiple doctors' offices, ERs, urgent care clinics, and such like that. That is part of their network. But so you have the opportunity to work at different places within a health system. But it also is a clinical medical assistant, health systems medical assistant, clinical medical assistant. Those are interchangeable titles as well. But great question. Okay, so we have someone popping on that says they missed the first lab and they want to get a hold of someone to do the first lab. So we will be sending out text invites for our next lab session. So no worries, you should be getting a text sign up from us very soon to re-sign up for that first lab. But again, you can always contact learner support as well, but keep an eye out on your text messages. And then one last thing we did want to mention on labs is that if you can't come, we totally understand because life happens. But if you could let us know or cancel on the invite, that'll open up a spot for some of our other learners because we do have a ton of candidates right now who are wanting to come to labs. Okay, so we had another question come through that is asking if this program is okay for undergrad students or is a degree required. So the program, you do not need undergrad for this program or a degree to do this program. So if you are in undergrad right now, you can do it. If you're not, you can do it. It's really meant for anybody who wants to take the program. The only requirement is that high school diploma. So we definitely encourage you to start it up. And then my team did just want me to mention for patient care tech, a high school diploma is not required to be hired, but for clinical medical assistant, you do need to have that high school diploma. So we have lots of options for everybody, no matter where you're at in your learning journey. And then my team also, the nitty gritty of each program, but in order to sit for the patient care tech national exam, you do have to have your high school diploma. So again, options for everybody, depending on where you're at, again, in your learning journey. But great question. So, another thing that, we always like to mention is, a lot of our learners will complete this program within that 6 to 8 weeks. But if you need a little bit more time or you want to slow down your pace again because you're working full time, you have pets you're taking care of, you have family obligations, etc., We totally get that. So just know that this program is designed to move at your own pace. It's designed for you to be successful. Our learner support team is in the background. If there's any other things too, like during the program that you want to brush up on, we actually have virtual lab simulators. We have practice tests built in, so you can feel completely comfortable going into, for example, your completion exam. You can feel comfortable after the 90 days being ready to sit for that national exam as well. It's really designed again for success, and we're here for you. So anything else, you guys are thinking, I just have this like little question and it's not on a live, always feel free to reach out to learner support as well. I did want to mention too, I mentioned before, we have had some people hired on in Detroit. We just launched Boston, so we're still working with our candidates. But for example, our candidate in Detroit who was hired on, again, we've had multiple people get hired on in Detroit, but she was really interested in working at a pediatric office. So after she finished her completion exam, she started work right away at a pediatric office. She's loving it. She's working as a clinical medical assistant in a pediatric office that is actually really close to her house. So again, when we mentioned health systems, we really are working with health systems, across different areas in totally different settings. So don't think it's just for a hospital or just for in office care. It's so many different options that our learner support team can help and our job placement team can help you with. So, okay, I think I saw another question come through in my chat. So we had somebody wondering about the fast track program. They say that they've been working as a medical admin already for a year. And so that is great news. That sounds like you would actually be a perfect candidate for our fast track program. You have some experience, you've already been working in healthcare. So we'd love it if you would reach out to our learner support team, and our job placement team will review your resume, confirm the experience you have, and then we can work with you on your placement tests and your skills opt-out tests to make sure you're all ready to go. And then we'll help you again. We'll still help you with your resume, your interview skills, and connecting with one of our hiring partners as well. Since you don't have that clinical experience, we might have you complete a few of the items in the online course and do the labs, but you'll be able to move through pretty fast to be able to test out of some of the other program requirements. Great question. Let's see what other things are popping through. The other thing I wanted to mention too is we are always announcing new programs and new opportunities on our social media channels. So make sure you follow us there. Another place you can get really great information and actually review some questions that have already been answered is on going back and watching some of our previous lives. So we've done a lot of lives. We've done some, as I mentioned, with Deanna, who's the lab instructor from Detroit. We did a live with one of our other hiring partners in Detroit as well. So kind of gives you a little bit of a glimpse of some of the other things that other students are wondering or asking, and some of the other things that we've talked about as well. So I definitely encourage you to go back and watch some of those lives as well if you're wanting a little bit more information about some of the other opportunities. Okay, so we just had another question pop through asking if a BLS certification, does that qualify for you, the fast track program? And so BLS stands for Basic Life Support, and that is a great certification, and it could qualify you for the fast track program. Or sorry, it won't. I read that message wrong from my team. It won't qualify you for fast track, but it will help you get hired. It's another skill that we'll be able to put on your resume. So when you're working with our hiring partners, they'll see that as a definite added bonus that you have more skills and more certifications as well. I definitely hope that you get in the program. It sounds like you have just the right background and the right skills needed to be super successful. Let's see what else we have coming through today. Okay, so Brad has a question on, can I really just finish the program in a few weeks? And the answer is yes, definitely. The program was designed for this. Our employers right now are looking for more staff than ever before. They're currently hiring thousands of positions right now. So we've designed it in a way to allow you to work on the course, especially the online portion, anytime, anywhere on your schedule. If you have 20 minutes here, 30 minutes there, you can really get it done quickly, get through your labs, take your certification exam, and be prepared to join a healthcare team ASAP. But again, it is on your time. So we have had candidates complete in a few weeks, and then some of them it takes a little bit longer. So definitely go ahead, start working, get off to the races. You're going to do great. Yeah. So, and then my team just, again, wanted to remind me in the background that, it can get done in as little as 2 to 4 weeks if you have the time. But again, if you don't have the time to get it done in those 2 to 4 weeks, totally fine. You can get it done within that time frame that fits for you. Okay, so what's the best platform for receiving news regarding this program? So our learner support team is always available to answer questions. So if you are wondering about something or wondering what's next, definitely contact learner support. If you're already enrolled in the program, you'll definitely be getting text messages from us. So definitely make sure your texts are coming through. And then we also update our Instagram and Facebook pages as well. So we really have all different channels, all different platforms set up to share news. And it kind of just depends. We've done that so we can definitely meet people where they are and make sure we're communicating with them on the platform that works best for them. Yep. And then my team also reminded me, we have a learner support chat on our website. So you can always visit the website and contact learner support there as well. Great question. And then we just had another question pop through on how long do we have to complete the program? So in terms of, how long you have, we really encourage everybody to get it done within 6 months. That's really the requirement of the program, is that 6 months, and that 6 months is also going to make sure you have all the knowledge retained to take your completion exam and your test out exams and different things like that. So we really encourage you to get things done in that 6 month time period. Again, most of our candidates get it done way before that, but if you need up to that 6 months, it's available. Okay, so we had a exciting question come in about job placement. What does job placement look like after the completion of the program? So the first thing you'll do after you complete the program is you'll contact learner support and let them know you're ready for the next step. So we'll review all your program assessments to make sure that all the requirements have been completed, make sure you've completed the required labs, make sure you passed the test, the ready to work completion test. And then you'll actually have a one-on-one session with you and our placement team. So we'll brush you up on your interview skills. We'll work with you on your resume to make sure all of your exclusive campus ed badges are there so they know what skills you've completed. And we'll get it all together again. And we have an exclusive platform that we use for these creating their resumes. The badges will be on there so they'll know exactly what you've earned, what skills you have. And then from there, our employees are going to make sure that they receive your resume in that format that they're expecting. It's going to be super easy for them to look at to know, yep, this person's qualified. This person is exactly what we're looking for. And you'll actually be flagged in their system as one of the ready to work candidates, because they are looking for candidates coming from us. And then from there, you will hear from their hiring team to set up an interview and to set up that interview and make sure to, like, you're applying for the jobs that best fit you. So there's going to be a lot of different jobs of the medical assistant in different settings. So we'll look at location, we'll look at full-time, part-time, and we'll look at in what setting. Is a hospital, is it a pediatric office, is it a surgery center, etc., to make sure we're really helping you apply for those jobs that are going to fit best with your lifestyle and also your wants and needs as well. And from there, the hiring manager will reach out to you, set up that interview, and hopefully, as long as everything goes well in the interview and you have the skills you need, you can move on from there. So, but it's really important that you apply with us and just don't go through the interview or through the application process on your own, because otherwise we won't be able to let the employer know that you came from the program, because we have a special partnership tied in with them. So it's really important that you work with us on your application, and so we can let the employer partner know that you're from Ready to Work. And so Brad just had a question on what organizations should we be expected to place with. So in Boston, our major employer partner is Mass General Brigham, which is a major healthcare system in Boston and the surrounding area. So again, there'll be lots of different options for location as well as medical assistant setting with Mass General. They're looking for medical assistants in hospital settings, again, but physician practices as well in a variety of different areas, pediatrics, dermatology, a big list of options. So again, if you are thinking about joining the program, definitely do it. Get in there, start working on your online content. Let us know what you think. Really, we know you can do it, and the candidates that we placed are really, really enjoying their new career, their new benefits, their new salaries. Well, also, I just got exciting news from my team in the background. We'll be opening up the pharmacy technician soon, which will connect with another major employer in the Boston area. So definitely stay tuned for that. And we'll make sure to do another live session once we launch pharmacy technician as well. And so we just got a question and one more question come through on do we pay for the national certification? So as long as you are hired on with one of our employer partners for the 90 days, your national exam cost is included in the program. But you must be, again, placed with one of our employer partners and work within that 90 days to have your national exam paid for, covered within the program. For most people, it won't be a problem at all. You're going to be on that track anyway. And you aren't able to take that national certification exam until that 90-day clock starts with our employer, which is just ensures you have the skills ready for that exam. And after that 90 days is up, you'll also get that certificate of completion from UMass Global. So again, it's that 90-day countdown is really important as you lead up into the completion exam, as well as or certificate of completion, as well as the national exam as well. So we're really excited for you guys. We're excited to be in Boston. We know everybody in Detroit is still working hard as well. We'll have some more lives coming up, so make sure to keep an eye on your text messages as well as our social media channels. If you need anything in the meantime, make sure to reach out to learner support. And we cannot wait for you guys to keep working and hopefully work with our hiring team soon. Thank you guys so much, and we'll talk to you soon. Welcome to Ready to Work. We are excited that your career journey has led you here. We've designed this Ready to Work program to prepare you to start work as a healthcare professional in as little as 2 to 4 weeks at absolutely no cost. Now that you've taken the first step in the application process, make sure you're officially enrolled. Complete the zero-cost enrollment and you'll be on your way. Our Ready to Work career training program will take you from the classroom straight into a job. We've teamed up with local employers to help build their healthcare team with new candidates just like you. With great pay and fantastic benefits, landing a job with our partner employers will be as easy as 1, 2, 3. Step 1. First, you'll complete the online job training to learn the foundations you need for success in healthcare. The online training has been set up to be completed anytime, anywhere, on your schedule. Step 2. Once you've completed your online courses, you'll be ready to start in-person labs. All you need to do is sign up for lab sessions held in your area. Our seasoned instructors will take you through a variety of exercises to ensure you gain the hands-on experience required to start your new job as a practicing medical assistant. In addition to attending live labs, you'll also have the opportunity for more practice through our virtual simulators. Step 3. You made it. Now the easy part. It's time to build your new resume to show ready-to-work employers you have the skills they're looking for in new hires. We'll walk you through every step to ensure you're ready to put your best foot forward and get started in your new career right away. Our learner support team is available 24/7 to help with any questions and assist with national certification and a certificate of completion from our university partners. With Ready to Work, you have everything you need to start your new career in healthcare. So what are you waiting for? Let's get ready to work.